Go ahead, Clayton.
Yep, this is Clayton Reese. The Board of District Technology meeting is convening at 9:06 a.m. on Thursday, March 18th, 2020 at the Health Licensing Office in Sale by phone conference call. I'll call the roll. Clayton Reese here. Grant Smith
Here.
Chris Chapman
Here.
Miguel Clark. Ron Ferris.
Here.
And just remember when you speak, please state your last name for the
Clayton,
record.
apparently you have a outdated script because Todd Young is now on the board. I want to call his name.
Young, please.
Here.
Sorry, Clayton.
For the record, public members calling in on the public phone line are asked to email April Fleming at april.fleming@ddhsoha.state.or.us and provide your first and last name. Public and interested parties' feedback may be heard during the public interested parties' feedback period if indicated on the agenda. Everyone is asked to use appropriate language, manners, and protocols when conducting board business. You want to talk about the new board members at this point?
We can. So Todd is a new board member. This is his first meeting, not first meeting on this term. He's been on the board before, but Todd, do you want to introduce yourself? Obviously not everybody can see you, but they can hear you.
Sure. My name's Todd Young. I've been in insurance for 20 years. Own a couple of clinics down in the South Willamette Valley. Also the owner of the American Dentures College. And I should say co-owner of Universal Testing Services. Yeah, excited to be back on the board and help serve the people of Oregon, provide access to care.
Thanks, Todd. Todd, do you know
Great,
everybody
thank you.
before?
I haven't met Clayton before. I did. Went back and read through some of the meeting minutes, and so I've been kind of catching myself up to speed on what's going on. And I didn't recognize Corinthia without her glasses, so it took me a second to figure out who that was up in the upper right of my screen. So, but I did remember Bob for sure. So yeah. So
right.
I've heard that you've become a better poker player. So that's I'm excited to come back and see this. So yeah.
Thanks. Clayton, do you want to introduce yourself to Todd? Since apparently he doesn't. He's not familiar with you.
Yeah. Clayton Reese, and I live in Beaver, which is south of Tillamook on the Oregon coast, about 8 miles from the coast, Pacific Ocean. My wife and I own a 70-acre horse ranch here, and my career has mostly been around public administration and human resources management. And my last position was with the state of Oregon Department of Human Services, in which I was a program manager for a youth transition program, administrating a federal grant as well as running the program. Been hanging out with this public administration stuff and spent a number of years in the medical field and human resources management. And just enjoyed serving people. I retired October 2010, and when I turned 70, and my boss asked me to come back, help with a federal grant, which I did for a little while, turned in 4 years. So I officially retired in 2014, and then I've been serving on a number of governor-appointed boards over the years as well, and I'm very active in my community here in Tillamook.
That's awesome. Nice to meet you, Clayton. I would like to ask a follow-up question though. What kind of horses do you raise?
We have a boarding facility, but we also have, for our personal animals, we have a kind of combination of appendix quarter horses, which are cross between a thoroughbred and a quarter horse, and we also have mini horses. So we have the little guys and the big guys.
My dad affectionately referred to those as pasture ornaments, right? That's awesome. Nice to meet you.
Yeah, you too. Okay, at this time, the Board of District Technology will hear public interested parties.
Oh, no. Sorry, Clayton, you skipped way ahead. We're on item number 2.
Okay.
So we need an approval of the agenda.
Oh, yeah, we got approval of agenda, thank you. Is there any changes or additions to the agenda for today? If not, otherwise, we will ask for a motion to approve the agenda.
I move to approve the agenda as presented.
You are.
Is there a second?
This is Chris, I second that.
The motion is to approve the agenda. It's been moved and seconded. All those in favor say aye. I will call the roll. Clayton Reese, aye. Graham Smith.
Aye.
Chris Chapman.
Aye.
Ron Ferris. Aye. Todd.
Aye.
And Nels Voss is not here, so.
Yep, just line through his name. You don't have to say his name anymore. Okay, so this is Sylvie. Next on the agenda is adoption of permanent administrative rules. You have a copy of the rules there in front of you. Sammy's on the call if you have questions. Again, this is just to make them permanent. We already talked about the proposed rule, and then there are 2 public comments that were received. Sammy, were those public comments received during the public comment period, or did they come in late?
Yep, during the public comment.
Okay, so there's 2 public comments. What?
I was just gonna give you an overview of the comment.
Oh, yeah, and I'm assuming all of you have read those 2 comments, and both of them are opposed to the new rule. However, the new rule is in place due to the law, so we can't not do it. Does anybody have any questions on this, specifically Todd, because you weren't around when we were working on it, or anybody else who may have questions?
Ron Ferris?
Yeah.
Yeah, not being into the discussion, I just had 2 questions. This diversity and inclusion, is this in the workplace, employee, patient, or both? I have 2 women work for me, and they're young. I think I'm in good shape. But that's the question, what the education, if we search for that, would it pertain to in-house employee, I say, or patient-based, or both? Then the other one is, it says every other time. How do we, is that odd years or even years, or every other for different person? I'm kind of curious. And then with respect to Todd's question, having multiple resources to get the education, I don't see an issue with, but it is a good comment.
Okay, that was a lot of questions. First one, the cultural competency is based on whatever Oregon Health Authority's Office of Equity and Inclusion has determined by rule. So they're working on that rule now. Obviously, this does not go into place until July 1. So they have until July 1 to get it in place and rule. So any class needs to meet their requirement, then it would automatically be approved. And then it's up to the licensee to get the 1 hour every other year and maintain it as part of their CEs. And so you as a licensee would keep that as part of your records. Every other year you need to take a class. If you take it more often, that's fine. But every other year you have to have at least 1 hour. And it will pertain to cultural competency related to co-workers and also towards clients. So it's a more general, I think, than specific to just clients. And I think those were all your questions, but if they're not, let me know.
Yeah, that covered the questions. The answers are still between here and July. Thank you.
Yeah, and this doesn't go into effect, and so it's anybody renewing after July 1 will have to have the cultural competency. We just wanted to get it out there early so that people know that they're going to need to start taking it. So say they need to renew in July, well, and then they're going to have a cultural competency class. And Todd, do you have your hand up? Do you have a question?
I do. So the definition of cultural competency is going to come in rule from this other agency. It is also the parameters of the CE, what's required to meet the minimum standards, going to be laid out?
Correct. And so this has already been going on.
Okay.
So and there's a link on our website to it, but there's a link over to their cultural competency education. So there's a whole list of classes that they've already approved.
How can they approve a class if they haven't? How can they approve a class if they haven't set what the parameters are for the classes?
Right, because what will happen is that a group, say a hospital or an association or somebody will contact them and say, hey, we're wanting to teach this cultural competency class. Would you approve this for all licensees and, say, nurses? And so they'll look at it, review it, say yes, and blah, blah, blah. Because there's several licensing groups that have already had to have done this for a long time. This now has added you guys in. And so this is new to you, it's not new to others. So, but the way this bill passed, the way your rules are written a little odd. So if you look at the actual rule language,
oh gosh, that's getting crazy. I know,
right? Number 7 is the one that talks about the Oregon Health Authority's approved list.
Yeah.
To the extent the board determines it's, blah, blah, blah. So that's new to you guys. And so they're working on extending the types of classes out because there's a whole bunch more licensed groups that come into effect come July 1.
Okay. Follow-up question to that.
Yeah.
Again, full disclosure, own and operate a school. Do you foresee this being a requirement for, as part of the education, the denturists or other licensed professionals receive?
We're talking about in the school environment, I would assume so. That's going to be through Department of Education, and for the private career schools, that's through HEC. But yes, this cultural competency is starting to spread and will eventually become probably mandatory everywhere. It's kind of going in steps right now.
Okay.
What the legislators' intent was to start out with the medical professions and then start growing out from there.
So we have the Board of Dental Technology has a policy paper on schools and what the minimum standards are for course requirements or subject matter areas.
Right.
And that's separate from DOE. We're not messing with that, right? We're not touching that. Okay.
Right.
No.
Just need to know. So, sounds good.
It's not going to come from a mandatory. It's not going to come from us.
Okay. Thank you.
Absolutely. Any other questions?
This is Clayton.
Yeah.
Todd, this is Clayton. I did some research on this particular issue, and if you want to look at some of the historical language, I know it's probably not high on your agenda to do, but House Bill 2611, which was passed back in 2019, I believe. Bob may know more about this than I do, but it lays out some language in terms of what's required for the continuing education opportunities and what they must do or what they must include in the CEUs.
Okay. Thanks a lot, Clayton. I appreciate that.
Yep. Any other comments? If not, Chair would entertain a motion to approve the adopted administrative rule.
I'll move to approve the rule, the proposed permanent rule as presented.
You are.
Yeah, sorry.
And is there a second?
This is Chris, I second that.
Thank you. It's been moved and seconded that the Board of District Technology adopt permanent administrative rules regarding cultural diversity. Is there any other discussion? If not, those in favor may say, Clayton Reed, aye. Smith?
Aye.
Chris Chapman?
Aye.
Ron Ferret?
Aye.
Todd Young?
Aye.
Motion passes.
Excellent, you guys are almost done. Bob, can you see if there's anybody on the phone in order to know whether or not Clayton needs to read his script?
Hi, for the public phone, this is Bob Bothwell, the Health Licensing Office. Is there anybody on the phone that would like to make a comment? You might be muted if you're there. Nobody spoke up? I don't think anybody's there, actually.
Okay, so there's no need to read the script for the public interested parties feedback because there's nobody on the phone to make a comment.
Okay.
So we'll move right along. Yep, go ahead.
Is there any other board business that will be conducted today?
Tammy, can you look and see when their next board meeting is, please?
You're muted.
Sammy, if you're talking, you're on mute.
June 7th.
Oh, good.
So is there anything specific that anyone needs or wants to make sure is on the agenda for the June 7th board meeting?
Well, go ahead, Todd. Go ahead.
Will the rest of these meetings be Zoom throughout the year, or is it we're just taking it meeting by meeting, or is there a plan in place?
There's no plan in place. It'll be this way for probably a very long time. It all comes down to the restrictions that the governor sets on our county. So Marion County is still only one step down from the, extreme high risk, and we just got dropped down. So,
Well, okay.
yeah, it most likely is going to be this way for a while.
Okay.
And I think
this is
it's cheaper. I think it's cheaper for the boards to do it this way because then people like Clayton don't have to travel to the office and we can still see each other and we can still do all this stuff. So most likely this will stay in place and even partially where some people may be in person at the office, but we'll still have cameras so that we can see individuals like Clayton who may not feel a desire to drive all the way to Salem, especially for a 20-minute meeting.
Perfect. I love it.
And we may be able to get board members easier.
Yes.
Enough travel.
Yes.
That's
Well, I've made that trip for 20 years from my grant here in Beaver, so it's not a challenge for me. If there's no other business to come before the board, we will be adjourned.
You have a little one-liner to read.
I'm lying. That's a good thing. The Board of District Technology meeting is adjourned at 9:26 a.m. on March 18, 2021. Thank you all for your participation.